Very warm welcome, a very warm good morning to one and all. I am Dr. Madeline. I am an associate professor in clinical infectious diseases division of internal medicine at Amrita Hospital, Kochi. My team is actually leading the One Health vertical of C20 of G20, and I'm privileged to be here to to moderate the first webinar of our One Health vertical. So, what is actually G20? It's, as we all know, it is a premier forum for international economic cooperation and decision making, and it comprises 19 countries and the European Union, and represent around 85% of the global GDP and over 75% of the global trade and 2/3 of the world population. So C20 or Civil 20 is a platform for the CSOs, that is the civil society organizations and the non-governmental organizations, to work together to influence G20 policy, to promote social and economic development with the vision of leaving no one behind. Mata Amritanandamayi Devi, who is belovedly called as Amma, who is the Chancellor of Amrita University, is chairing the C20 part this year. And this gives us this wonderful opportunity to become a part of C20. I take this opportunity to thank Dr. Jaideep Menon and Dr. Priya Nair for this wonderful opportunity, for giving us this opportunity of hosting this webinar. One Health is never a new concept. It is one of the key focus areas in the Integrated Holistic Health Working Group of C20. Now we have a video of Integrated Holistic Health C20 intro video, and I think Shubhla can help with the intro video to be played now.
This year, the C20 Integrated Holistic Health Working Group will comprise 7 subgroups with areas of focus that include mental health, nutrition, women's and children's health, elderly care, holistic health including traditional medicine like Ayurveda, as well as yoga and meditation, the reduction of non-communicable diseases, and One Health, a concept that highlights the interdependence of human, animal, and environmental health as one species, one world. Delving into these themes, we aim to widen the discussions on different facets of Sustainable Development Goal 3, good health and well-being, with policy building meetings and series of public webinars and awareness campaigns that will take place throughout 2023. These discussions will bring together health professionals, educators, and leaders from across the public health landscape to formulate policies that support global health and well-being. Inspired by the humanitarian activities of Amma, Shri Mata Amritanandamayi Devi, the present chair of C20, we hope that this upcoming series of events will raise the general awareness in society and spark interest in people to contribute to the conversation surrounding global health. As we embark on this journey to understand the health of the world around us, C20 will offer all members of civil society an opportunity to recognize how our individual experiences and efforts can lead to policy change. Let's work together to create a healthier, more equitable world. Good health is a fundamental human right, and it's up to all of us to make it a reality for everyone.
Thank you.
1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25 26 27 28 29 30 31 32 33 34 35 36 37 38 39 40 41 42 43 44 45 46 47 48 49 50 51 52 53 54 55 56 57 58 59 60 61 62 63 64 65 66 67 68 69 70 71 72 73 74 75 76 77 78 79 80 81 82 83 84 85 86 87 88 89 90 91 92 93 94 95 96 97 98 99 100 101 102 103 104 105 106 107 108 109 110 111 112 113 114 115 116 117 118 119 120 121 122 123 124 125 126 127 128 129 130 131 132 133 134 135 136 137 138 139 140 141 142 143 144 145 146 147 148 149 150 151 152 153 154 155
So, One Health acknowledges the interdependence of human, animal, and environmental health and relies on the cross-sector and cross-discipline collaboration, including public health, veterinary, and environmental sectors to effectively address health concerns at human-animal ecosystem interface. Raising awareness and encouraging multidisciplinary cooperation and participation is essential to tackle One Health issues. Now, One Health is never a new concept. However, it has assumed so much of importance over the past years. One Health correctly describes the interconnectedness of all these realms. And again, in this session, we will be discussing regarding One Health in malaria. Once again, malaria is an age-old disease which had been understood for so many years. However, the complex interaction between humans, the vector, which is the mosquito, and the plasmodium has been well elucidated decades back. However, in spite of all these advancements in the treatment, in the diagnostics of malaria, WHO estimates show that around 2.5 million cases are there of malaria, of new malaria cases occur on an yearly basis, and out of which around 6 lakh deaths are reported. So this actually shows an unmet need for more strategies to come in. And there have been several challenges, including the changing mosquito behaviors, the emergence of urban adapted mosquitoes like Anopheles stephensi, drug resistance, and the like. Vector control has always been the key component of the prevention strategies. And that being said, malaria represents a disease that has striking impact for the One Health model approach. Now, we have an array of very eminent speakers with us for this webinar, and the objective of our webinar is to bring together experts from the field of malaria and One Health to highlight the importance of holistic diseases elimination approaches and the needs of the communities impacted by complex but interconnected issues. And as an outcome of webinar, we look forward to reflect the interlinkages between malaria and other cross-cutting factors like animal health, environmental factors, population motility, and the like, and highlight the challenges and needs of communities affected by these complex issues. Now, let me move on to the speaker introduction. We have opening remarks by Dr. Vanta Marcotta. Dr. Vanta Marcotta is the co-chair of WHO One Health High-Level Expert Panel. She holds a PhD in virology from the University of Pretoria, South Africa, with a part of this research completed as a visiting scientist at the CDC USA. She started her academic career at the same university in 2004 and is currently the director of the Center of Viral Zoonosis Department of Virology. And Professor Marcotta is currently one of the co-chairs of One Health High-Level Expert Panel. Due to unforeseen circumstances, she could not join today's webinar. However, she had been so passionate about the One Health in malaria. She sent us a video message to be portrayed. The opening. So I kindly request to share the video message, the opening remarks in the video message.
Good morning, good afternoon, and good evening, and thank you for this opportunity to join this event, and my apologies for not being able to attend it in real time. I will share some information specifically from the One Health High-Level Expert Panel that was established in May 2021 to advise the Pod Department, which is FAO, UNEP, World Health Organization, and World Organization for Animal Health. Originally, our focus has been very much on zoonotic diseases, but we are advising on a much broader picture on One Health, which include long-term strategic approaches for zoonotic pandemics, but also for other diseases where we need a One Health approach. So the panel consists of several members from all regions of the world with a high range of expertise. And one of the first things we did was developing a One Health definition that's really including all aspects of One Health. And this definition specifically states that One Health is an integrated, unifying approach aiming to sustainably balance and optimize the health of animals, people, and ecosystems. So sustainability, unifying approach, integrated is important words here. It recognizes that the health of animals, humans, the wider environment, which is the whole ecosystem of closely interdependent. And then what is also important in this definition and also in these discussions around malaria is that this approach mobilizes multiple sectors and disciplines, but also communities on varying levels of society to work together to foster well-being, not just the presence or absence of disease, but the word well-being is quite important here. And while doing all of this, it's also addressing the collective need for other aspects like clean water, energy and air, safe and nutritious food, taking action on climate change and contributing to sustainable development. So this is really a definition including everything. And what is also important, we published One Health foundational principles together with the definition, which is actually really important if you look at future plans also around malaria. And one of them is equity between sectors and disciplines, socio-political parity, where we say that all people are equal and deserve equal rights and opportunities. And this includes engagements with communities and marginalized voices, socio-ecological equilibrium, stewardship and responsibilities of humans to really look at sustainable solutions, and then transdisciplinarity and multi-sectoral collaboration, which include all disciplines, but in addition to this, it also must look at modern and traditional forms of knowledge, and a very broad spectrum of perspectives must be included in these discussions. One of the things that the quadripartite did as a joint action is developing a One Health joint plan of action that's been published, and there will also be an implementation and monitoring and evaluation plans. And this is really a plan that I think can be used much broader than just zoonotic diseases when designing programs to eliminate or control diseases going forward. It's got an action track on general One Health capacities and how to strengthen One Health systems. Then there is an action track on zoonotic diseases, but I think what's really important for malaria is action track 3, which also include control and elimination of endemic and neglected and tropical vector-borne diseases. And this is also relevant in terms of malaria and can be used as a roadmap to develop One Health action plans going forward. ILAB also developed a theory of change that's also been published on the website, where we look at a broader range of factors, including societal, environmental, and animal health challenges, and how it's influenced by several anthropogenic influences, and then looking at that through a One Health lens to try and find solutions following a One Health approach. So in the context of malaria, One Health is extremely important if we look at the animal, the human, and then the environmental factors, and also the behavior factors that influence this. And it needs to be addressed following a One Health approach, looking at all these factors holistically, but also getting the right actors around the table, which include disciplines, multiple sectors, but not forgetting the marginalized voices, the modern and traditional forms of knowledge, and also getting communities into these discussions and policymakers when we discuss the plans around how to eliminate these diseases going forward. So good luck with all your discussions today, and I hope it is a really fruitful event. Thank you.
I must thank Vanda, even in her absence, for the wonderful opening remarks. Vanda has told about that a very concise definition, which is the integrated, unified, sustainably balanced health of ecosystem humans and animals. That is actually One Health. So I think that pivotal thing there is the sustainability. And health, she has also told that health is not just the absence of disease, and equity is the key for One Health. And also transdisciplinary and transsectoral collaborations are important. I think she also mentioned regarding One Health action plan, which needs to be a broader one and not just encompassing zoonotic diseases. Also, she touched upon the complex interactions in malaria and the need for getting discussions from the community regarding malaria prevention strategies. So thank you, Vanda, for that. So let us move on to the main speaker introduction. So we have three main our panel discussion consists of three main sections and of 15 minutes each. And we have three eminent panel speakers. Let me introduce them one by one. First is Professor Tom Burcott. Prof. Tom Burcott is a research leader in the Australian Institute of Tropical Health and Medicine. He previously worked as research entomologist at CDC in USA from 1991 to 2011, focused on the transmission of malaria in Africa and Asia. Dr. Burcott developed the first enzyme-linked immunosorbent assays to identify and quantify human sporozoites in the mosquito vectors while serving as the National Research Council Fellow at Walter Reed. Prof. Burcott is a member of American Society of Tropical Medicine and Hygiene. He holds positions on several advisory groups related to malaria elimination and vector-borne diseases, including Malaria Policy Advisory Committee and the Malaria Elimination Oversight Committee of the WHO Global Malaria Program, the Aedes albopictus Torres Innovative Vector Control Consortium, and the Management Board of Building Out Vector-Borne Diseases in Sub-Saharan Africa. Prof. Burcott has published over 150 articles in the highest ranked international journals and have received over 9,500 citations. I heartily welcome Prof. Tom Burcott to be the panel speaker for today.
Thank you. It's a pleasure to be here with you. Thank you for the invitation.
I'll move on to Dr. Kuat Tihai Oan. Dr. Kuat Tihai Oan is a medical doctor who graduated from Hanoi Medical University. She has a master's degree in sexual and reproductive health research from London School of Hygiene and Tropical Medicine. Dr. Oan is committed to creating an inclusive society and contributing to Sustainable Development Goals agenda by improving the lives of most vulnerable and marginalized populations. She played a key role in realizing the first ever global fund to fight HIV program implemented by the communities and civil society in Vietnam starting in 2011 and making it a grand success. Dr. Oan is the chair of VCSPA, largest platform of civil society supporting vulnerable populations in Vietnam. She is the chair of Council of Representatives of Asia Pacific Coalition of AIDS Service Organization and the chair of Global Fund Advocate Network in Asia and Pacific. Dr. Oan is a member of the advisory group on the community, rights, and gender issues in the Global Fund on AIDS, TB, and malaria, and a member of the Strategic Technical Advisory Committee on HIV and viral hepatitis for the World Health Organization. In 2017, Dr. Oan was listed as among the 50 most influential Vietnamese women by the Forbes Vietnam. Dr. Oan, I welcome you to this panel discussion.
Thank you so much. Good morning, good afternoon, everyone. And thank you for organizing this important section and for having me. It's an honor for me.
Moving on to Sri Prashant Kumar Swain. Dr. Sri Prashant Kumar Swain is the Additional Secretary and Agricultural Marketing Advisor, Government of India, Ministry of Agriculture and Farmers Welfare, and Director General of CCS NIAM, National Rain Fed Area Authority, Ministry of Agriculture. After completing his stint in Ministry of Agriculture, Government of India, where he served as the Additional Secretary to the Government of India, and prior to that as Joint Secretary in the Ministry. As Joint Secretary in the Ministry of Agriculture, he also served as the Agricultural Marketing Advisor and worked intensively for agriculture marketing reforms and development of agriculture markets and supply chains. He was instrumental in the market reforms initiatives such as Model Contracting Farming Act, Model APML Act and Farm Laws, etc. He has developed and rolled out the state-of-art electronic wholesale trading platform of ENAM and integrated 1,000 wholesale markets in India to make it globally the biggest e-trading platform for farmers to facilitate selling their harvested products easily. As Additional Secretary, he worked for development of natural farming scheme in India and has also represented India in COP26. He has been conferred in many prestigious awards such as Digital India Award and Hindu Business Line Award and Digital Transformation Changemaker Award due to his pioneering developmental work in agricultural field. Currently, he is engaged in rain-fed area development through application of science and technology such as remote sensing, application of sensor for soil moisture and soil health extra for soil conservation, groundwater recharging, and demand-oriented crop planning. Sri Prashant Kumar Swain, I welcome you to this panel discussion.
Thank you, Dr. Marlin. It's a privilege to be here. It's a privilege to be here with amongst the galaxy of very intellectuals who are driving the entire globe in the subject that is being discussed. I welcome all the international participants also on behalf of India, Government of India, and on behalf of 140 billion people of India to this C20 first webinar. Thank you and wish you all the best.
I also officially welcome Dr. Sarthak Das. Dr. Sarthak Das is the Chief Executive Officer of the Asia Pacific Leaders Malaria Alliance. Dr. Sarthak joined Asia Pacific Leaders Malaria Alliance from Harvard T.H. Chan School of Public Health, where he holds appointments as research scientist in the Dean's Office, Department of Health Policy and Management, and as Senior Advisor for Research Translation and Government Health Policy at the Harvard Global Health Institute. He brings 25 years of experience as a public health scientist, development practitioner, and global health policy advisor. His work spanned from diverse Asia-Pacific settings in countries such as Cambodia, India, Indonesia, Laos, Vietnam, Myanmar, and Papua New Guinea, as well as West Africa. Dr. Sarthak graduated from the Harvard College with a joint AB in Social Anthropology and Sanskrit and Indian Studies, and holds a Master of Public Health from the Yale University School of Medicine and a doctorate in Public Health from the University of North Carolina, Chapel Hill. Dr. Sarthak Das will be offering the closing remarks at the end of the session. And Dr. Sarthak Das, I welcome you to this meeting.
Thank you.
Now, shall we move on to the questions to the speakers? So, as we have organized the panel discussion in such a way that we have 3 sessions of 15 minutes each, and 3 questions each in each session. 1 question each to each panel member, where they can elaborate on the question. And I must say that there won't be any questions, there won't be any audience questions in between the session. We will definitely take audience sessions. We have the chat box for that. The audience can put the questions in the chat box, and we'll be screening the questions. And towards the end of the session, we can have the discussion on the audience questions. So the first, we can begin, I think we can begin the session with a question to Prof. Barkot. Dr. Burkott, Prof. Burkott, what are some of, in your viewpoint, what are some of the cross-cutting issues from the lens of One Health, which are linked to the transmission of malaria in the Asia Pacific region? Can you just elaborate on that?
Okay, great. Thank you. Let me just start out by saying that I found the introduction very interesting about how One Health is not a new concept, and it's certainly a concept that is it's a principle underpinning the whole strategy behind mosquitoes surveillance and control, malaria surveillance and control. And so what I want to do is start out by talking a little bit about some of the big trends that are ongoing in the world today, and try to relate that to how One Health can contribute to the control of malaria. All right, can you see my screen correctly? You see the large screen? Great, thank you. Okay. But I also want to do is I want to make some comparisons between the malaria vectors in Asia with that in Africa. It's a good contrast, and I think it helps put in perspective the mosquitoes that we have in Asia. And the first thing that's really obvious is that the vector complexity is far greater in Asia than it is in Africa. So you've got about 7 dominant vectors in Africa, and that'll have a lot of implications for the strategies and the major trends that are going on. Whereas in Asia, we have a lot more different species complex and a lot more different behaviors. So I think it's a really important difference between Africa and Asia that we need to appreciate. The second thing I want to say is these maps showing the distribution of the vectors, they're not static. The mosquito that was alluded to in the introduction about Anopheles stevensii, and here we see the changing distribution. This is from the WHO malaria threats map. We see it from in 1995 what the recorded distribution was, which was largely confined to the Indian subcontinent, and then by 2005, the mosquito had broken out and crossed across the Arabian Peninsula. And by this year, it's all the way across Africa, all the way to Algeria. Invasive species, we always have the international health regulations, which talk about doing surveillance at ports. So I want to call your attention to the one red dot, which is where Sri Lanka is. And that is believed, it's been hypothesized that mosquito traveled there borne on the wind. So not by human assisted transport, but by being blown by the wind and getting established in Sri Lanka. And that has all sorts of implications for community engagement, for increasing surveillance, and we have to have surveillance over a much larger area in order to, if we're having to face mosquitoes which are being wind-borne. I also want to point out that the whole example, this is the most famous example, recent example of movement of an important malaria vector, but it's not the only one. Recently, there was the introduction of Anopheles bancrofti from Darwin in Australia to New Caledonia, an area that had never had Anopheles before. During the American War with Vietnam, when America was flying a lot of armed forces from Vietnam to Guam, they also carried with them 9 different Anopheles species, which became established in Guam and actually were responsible for local transmission of malaria in Guam, something we haven't seen in New Caledonia yet. Okay, another major trend I want to say a little bit about is insecticide resistance. And this is the map WHO and a lot of those mosquitoes are mosquitoes which have changed their behaviors to avoid contacting the insecticide. And this is an even bigger threat because it destroys the whole paradigm of mosquito control. For example, insecticide treated nets or into residual spraying where the mosquitoes have to enter the house to contact the insecticide and be killed. with behavioral resistance, the mosquitoes don't enter the houses, and therefore that whole paradigm of insecticide treated nets or indoor residual spraying is lessened. So that means we have to have new strategies, new ways of controlling mosquitoes. And every time we have a new strategy, you also have to have community education to get acceptance and buy-in from the communities, because as we roll out different sorts of interventions to control the vectors of malaria. Another major trend which has been occurring is the urbanization, and the WHO's Strategic Advisory Group on Malaria Elimination, in their analysis of megatrends, looked at urbanization and said basically urbanization would help to diminish the threat of malaria, because urban communities tend to have better education, they have a higher standard of living, there's fewer larval habitats for the vectors, and that's certainly is a major trend. But there's other factors that are coming into play, and one of them, going back to, is Anopheles stevensii, which is one of the few urban malaria vectors, and now that its distribution is spreading, it is a major threat to the elimination of malaria. A important strategy, and again, it's going to take a sort of a multi-sectoral approach to be able to attack this vector. But having stevensii, we always used to talk about the concept of integrated vector management, using one control strategy to control multiple vectors of different diseases. And this is really a good example. Stevensii and Aedes aegypti, the major dengue vector. This is an opportunity to do integrated vector management in a meaningful way to attack both malaria transmission and dengue transmission by, since both these vectors oftentimes share small aquatic habitats that are found in urban areas. So it's one of the few examples that I know where we really have a good opportunity for doing integrated vector management. Another major mega trend in the world is changing land use change across the world. And here we see the locations mapped out of where logging, mining, and oil palm concessions are around the world. And so this very heavily influenced in Southeast Asia. If we focus on tree cover loss by a number of different factors, it's rather staggering how important this is. And that has some really important implications for malaria transmission. You recall earlier when we talked about Africa, it had fewer vectors. Well, Africa only has one dominant vector, which is found in deep forest. So when it actually, the number of malaria will actually increase in there quite dramatically, because you have 6 other dominant vectors which can take advantage of fragmented forests and deforested areas. The situation in Asia is far more complex, because we have more mosquito species here. We have a number of dominant vectors habitat. The deforested habitat is oftentimes then taken advantage of by these other vectors, and so you'll get a rebound effect. So it's a very different sort of situation. It's going to be very local how that will change with time. But again, here we have a scenario where we need to be working with, the forestry sector as well as the agriculture sector, because oftentimes things like oil palm plantations are brought in to fit in the mix here. In conjunction with the tree cover loss and deforestation, we have the issue of monkey malaria, simian malaria parasites. And we always talk about we always hear about Knowles-Island malaria, particularly in relation to the numbers of cases in Malaysia. But there's also a number of other different simian malaria parasites which are infecting humans. And this is a major concern for the elimination of malaria, because with the definition of the World Health Organization that more than 10 cases of simian malaria parasites will stop certification of malaria elimination in the country, means that we don't really know a lot about how to control these vectors. We don't know a lot about them. And so this will be a major hurdle for countries where monkey malarias are present to be able to achieve elimination. Now, I've talked a lot, probably too long, about a number of major trends in affecting the vectors of malaria. But really, a major trend, you can't really get away without saying something about climate change. And here, the situation is a bit complex and surprising, because the analysis of changes in temperature over the last 100 years against malaria cases actually suggests that climate change is not really driving an increase in malaria transmission. There's overall a slight trend of decreasing malaria cases despite the changes in temperature. But again, temperature and rainfall patterns will change the vectors and the parasites and the rates of multiplication. So it's something that we'll just have to follow. But it is a major trend, and all these major trends, I think, are going to require the input of multiple sectors to actually effectively combat. And I'll close at that point. And I think I've spoken for too long already. Thank you.
Thank you, Prof. Burkott, on that bird's eye view on the new trends in the transmission and the current trends. So moving on to the next question, Dr. Oang, can you please highlight from a community point of view, what are the different interlinked issues in terms of disease, in terms of environment, housing, water, and sanitation, and maybe occupation and natural disasters? That what are those issues which communities face in their everyday lives that impact their overall health and wellness, and also access to health services as well?
Yeah, thank you very much. I think for the interest of time, I will not be able to cover the whole things. However, I just want to take this opportunity to share with you some of the image, some of the picture that I took. I myself took during my field visit in the area that we have a malaria endemic in Vietnam, and I could not stop but thinking about one ill health. We are talking about one health, but it is really what we are seeing now is one ill health. The people are ill, the planet is ill, the animal are not well. So let me share with you some of the picture. And that is what we supposed to be in the middle of forest. I travel with our community outreach worker, cross the river, cross the stream, go in a very, very dirt road, and so on, to go deep in the forest. And that is what we saw in the supposed to be deep in the forest. The forest has been cut down, like a Burkott talking about. We lost the tree cover. People cut down the tree, but it's not only that. What made me even more worried is that people are beside to burn the grass. So when I saw the grass dry like this, they were like, what is happening? It's not that people physically put the fire to burn, but they put the Agent Orange, they put the insecticide in order to clear the grass so that they can grow crop, they can grow maize and other crop, which really break my heart. Because then the chemical go into the soil, go into the river, go into the stream, and then people and animal would drink the water. So you can see that when the living environment is ill, is sick, is not well, then how can we be well? So, and we are in an interconnected world. So if one part of the world is like this, I think the whole world is not well. And I know that it doesn't happen just only in Vietnam. It doesn't happen just only in one place where I visited. It is the phenomenon that we could see in a lot of places. Maybe different practice. Maybe they burn the part of the forest to grow crop, but nevertheless, we see the scary environment, as we can say. So how did we get there? I show you some picture here. You see the beautiful orchid. So at some point in Vietnam, it's a fashion to have a forest orchid back to the city. So we hang the orchids to decorate our house and our garden, the cafe, the villa. They come from the forest. And people went to the forest to pick up the orchids from the forest to sell for money, to earn as little as like $5–10. But by doing so, they are taking a part of the forest away. Because now we don't have much tree to cut anymore, so they are exploiting forests in a different way. And then there are some trees left, and you saw in the middle, the picture in the middle is a tree from the forest, brought from the forest to decorate a cafe. So it's also now the fashion that we have a exotic tree from the forest to decorate the house, the building, etc. So it's when there's no valuable timber anymore, it's a tree, flower and other things. And when for the people who don't have the equipment and truck and so for the tree, the last thing that people could do is to pick up bamboo shoot from the forest. So everywhere I went, the poorest people who have no equipment, the poorest forest, whatever left is the bamboo, and they pick up the bamboo shoot. It's very cheap, so people have to collect a lot in order to have enough money to buy their food, their rice, and to afford their survival. So I am not criticizing the people who did this. The bottom line is that the poverty, people are so poor that they have to take the risk, going in the forest, taking the risk of having malaria and all sort of problem in the forest, being caught by the forest protector. So because most of our forests now are protected forests, they took the risk in order to earn a poor living. I have to say a poor living. So it's we are paying the planet health for what we don't do in terms of poverty reduction. I'm talking of animal health. So in more than one places, there are a number of places where I went. So source of protein for people there are the animal, the forest animal, but there's not a lot of animal left. So what now? People catch basically rat from the forest, and they don't even have the luxury to eat the rat they catch. They have to save it for when they have a party or special ceremony. So they are trying to catch whatever animal they could from the forest, and to be able to to feed themselves. So I think we have heard about the zoonotic condition, the virus that transmit from bat, from monkey, from animal to human. When people cannot afford other choice for life, then the forest is still the place that the poorest people have to go to find a living. Of course, luckily this doesn't happen to the vast majority of the population, but as long as we still have people who need to go to these very last resources to survive, I think it is a shame on us. We haven't done enough to prevent this. And that is where the mobile population live in the malaria endemic area. People would move from one province, one place to another place to grow the crop. Here is a watermelon, and this is where they live. The whole family in this small tent. Imagine if somebody had TB, everybody would share the germ. In the middle of the field, with a lot of tree around, you can think of the risk of malaria and other health problem. So in the middle of the COVID pandemic, we visited the village, and you could see on the left is a mask that I just happened to see it. If people can afford to have a mask, it is a mask that many of them would have reuse and reuse and reuse. And then on the right is a person who had malaria before and who was having TB by the time of my visit. You can see the condition where he lived in, that is his house, and just that he lived with his daughter. And then there are many other problems that come with poverty, come with isolation, come with the lack of access to information and education and health promotion. Drinking is a very common problem among the ethnic minority group where we work in the malaria area. Women drink, men drink, young, old age, and smoking. In the middle, you see a pie that they invented to smoke tobacco. And then who care about road safety? Look at the motorbike, and the fact that nobody wear helmet is not only that they are not used to, but helmet costs money. So just like a endless health problem, endless health issue for the people who live there. Family planning. This lady is not even 30 years old, and she had 5 children. And look at what they have to eat is maize, and that's it. So nutrition is a big issue, and you know that go together with nutrition is many other health and development matter. So I just want to share with you some of these image for you to have a kind of a visual about what is happening with some part of our fellow people on this planet, relating to the way they live, the condition they live, the condition where animals live, and the condition of the environment where they live. So just to give you some thought about the ill health that I would like you to think about. Thank you.
Thank you, Dr. Oan, for giving us some real-time glimpses of the issues which we face. Now, moving over to the next question to Shri Prashant Kumar Swain. Sir, One Health approaches require multi-sectoral and transdisciplinary collaboration and cooperation. From a policymaker perspective, can you tell us more about some of the steps taken at national or state level or considered to implement One Health approach in India?
Thank you, Dr. Marlin. First of all, I pay my regards to Mata Amritanandamayi Amma for chairing this C20 and leading the globe in terms of spiritualism, education, health, and the universal well-being of the people. So having paid my reverence and regards to Amma, let me thank the organizers for inviting me to this One Health, Malaria and One Health. Though I am working in the agriculture sector, certainly this One Health is an issue I'm realizing with this session, that it is more of transdisciplinary, multisectoral. Professor Burkert has already clearly brought out the macro detailing. He has made the macro detailing of how the malaria has spread, the root cause of it, and Dr. Vahan has very clearly brought out the socio-economic and cultural aspect and genesis of the zoonosis and malaria. Having said that, now it is time to talk about, as Dr. Merlin has asked, about what in the Indian context that I bring in as a policymaker. So let us understand what is this One Health. From there, I'll bring it to the actions which have been taken in Indian context. Of course, the One Health Commission 2011 had very clearly brought out that One Health, which is already been spoken by many speakers. It is a collaborative efforts of multiple disciplines working locally, nationally, and globally to attain optimal health for people, animal, and our environment. So it has three components of local, national, and global. Three things are there in this. So it recognizes the inextricable linkage of human, livestock, and companion animal and wildlife health. Having said that, the collaboration is required between veterinary medicines, human medicines, environmental and social sciences, wildlife, and public health. If you are to see the statistics, like 60% of existing human infectious diseases are zoonotic. 75% of emerging infectious human diseases have an animal origin, and 5 new human diseases appear every year, out of which 3 are of animal origin. Having said this, I don't want to scare the audience, but there are 1 million vertebrate viruses, of which only 2,000 are known so far. So having said this, that means there is a large potential for zoonotic emergence. So having spoken about this, let's see, the world has veered around from one medicine aimed at addressing animal-human interactions, passing through eco-health, advocating for inclusion of environmental health, to one world, one health. So that is the transition we have made now, whereby the One Health approach has finally recognized the importance of linking human, animal, and environmental health, which means human health, animal health, agriculture and plant health, environmental health. So One Health is not about just paying attention to zoonosis, but also to areas such as interface between sustainable agriculture production practices, reduction of pesticides, improvement in soil health and fertility, natural resource management, climate change, and biodiversity conservations. So having said this, let me say it aims to improve the communications between sectors. It promotes disease surveillance activities. It helps develop uniform messaging to public. Let me talk about the Food and Agriculture Organization, because agriculture is also as much involved as the animal health, as much as the public health. So FAO, that is the UN body, in collaboration with the World Organization of Animal Health, OIE, WHO, World Bank, UNICEF, gave a joint strategic framework in 2008 called Contributing to One World and One Health. So a strategic framework for reducing risk for infectious disease at animal-human ecosystem interface. So that means agriculture organizations are no stranger to this One Health concept, and they have been actively working on this. In fact, it was the FAO which took a lead in jointly with the WHO and World Bank and UNICEF and OIE to bring out this one strategic framework for reducing risk for infectious disease at animal health human ecosystem interference. So having said this, the framework aims to assist national authorities in initiating steps to strengthen efforts towards the control of zoonosis and antimicrobial resistance. So that is the steps which is marking the kind of global major joint venture cross-sectoral effort to towards the One Health strategy. So having said this, let me come back to the Indian effort, because it is local, national, and global. From global, I'm coming to national and then to local. The national initiatives in India is no stranger to One Health, though we have not been branding this One Health since very long. It is of recent origin. This word in India is of 2019. But then India initiated its efforts to bring together human health and animal health in 1980s. That was the beginning when world was thinking about it. We also in India thought about joining this together. This process was guided through the National Committee on Zoonosis that was co-chaired by Director General Health Services, Ministry of Health, and the Animal Husbandry Commissioner, Department of Animal Husbandry, Ministry of Agriculture. So there was a first interaction between the Ministry of Health and the Department of Animal Husbandry to bring together this issue of human health and animal health together under one umbrella. And at the same time, the various states, because India has various states, and states level committees were also set up in many of the states to handle this issue jointly. There have been instances of collaborations at national and state levels to combat the specific diseases such as National Influenza Pandemic Committee to control avian influenza, and even joint effort in controlling rabies in Tamil Nadu and other states. Institutes like Indian Council of Medical Research, ICMR, and Indian Council of Agriculture Research, both, have collaborated for joint research priorities, mostly to control disease outbreaks. The Integrated Disease Surveillance Project, launched in 2004 for disease outbreak detection and rapid response functions, has generated several information on flow of certain diseases outbreak, but the program, of course, was limited and had been unable to integrate human and animal surveillance. But there is there is a kind of integrated effort at that level also. Thereafter, a multidisciplinary roadmap to combat zoonosis was laid in 2008 to create an integrated mechanism for surveillance, detection, and treatment of zoonosis. It identified several strategies for research, but integrated surveillance of human and animals has not been brought out very effectively so far in that. Recently, there have been several proactive steps which acknowledges the relationship between biodiversity loss, changing land use pattern, and zoonotic diseases in India. The National Mission on Biodiversity and Human Wellbeing, built on a framework that integrates biodiversity, ecosystem services, climate change, agriculture, health, bioeconomy, and capacity building in the realm of biodiversity science, has one mission component that explicitly links biodiversity to human health through One Health approach. Department of Biotechnology, Ministry of Science and Technology, Government of India, took first step in May 2020 to set up a national expert group on One Health, comprising experts from interdisciplinary, multidisciplinary, and transdisciplinary sectors. The department prior to this had organized an international seminar, One Health India Conference 2009, where there are a lot of international organizations and were invited to participate, where they defined One Health roadmap with multi-sectoral approach. The other issue is that under PM Ayushman Bharat scheme, set up district integrated public health laboratories services in 2016, which is a major step to enhance public health capacity to collect and analyze samples and to respond to disease outbreak, and is now a part of National Health Policy 2017. That is a major step in surveillance and detection process. The Government of India has decided to set up, with assistance of guidance of ICMR, a Center for One Health at Nagpur to contain zoonotic diseases. In December 2021, Department of Biotechnology again has launched One Health Consortium with aim to study the prevalence of 10 selected zoonotic diseases throughout the country and 5 transboundary animal diseases, which are mainly from across the border through northeastern states, and analyze risks so as to provide forewarning to states, stakeholders, and to have a cross-cutting collaborations in that. Following this, in 2022, India launched One Health pilot in 2 of its states, Karnataka and Uttarakhand, with focus on zoonotic diseases. So in the past, India has successfully combated several zoonotic diseases and has a robust institutional framework for biomedical research, which can lead to and operationalize One Health approach. It is important to develop database models with a constructed approach of ecologists, field biologists, epidemiologists, and others. The Kasunur forest disease model is one such successful example. So let me stop here at this moment. So India is already on the track on One Health. It may not have exclusively defined One Health subject, but it has been working. In fact, in Agriculture Ministry, we have been working on the sustainable agriculture, reduction on the greenhouse gases. We are for improving soil health, improving the natural resource management. And today, we are focused on food security with nutrition security. Earlier, we are production focused. Today, we are production, along with production, we are focusing on food and nutrition security and income enhancement. So that is why we have also come under this. We are focusing on doubling of farmers' income, which is a major thing, that is income enhancement, so that they can have a kind of good service for themselves, whether it is healthcare, education, and other sectors, to have a better quality of life. Thank you all for listening. Thank you.
Thank you, Dr. Singh. The effort for telling us how the different departments, different ministries in India are working together to have this One Health in action. So the effort is really laudable. This marks the end of our first session. So we'll be going to the second session with 3 questions of 5 minutes each. I must remind you that actually we are slightly running short of time. So I request the panel speakers to keep their time of the response to 5 minutes each. So over to Professor Tom Burkott. So Professor Burkott, malaria control has traditionally been malaria-specific vertical programs. But does the concept of One Health really align with the present WHO policies and recommendations as delineated concepts like integrated vector management and the global vector control response? Can you, what is your remark on that? And we would like to hear from you.
Well, I think when we think about malaria control back in a century ago, the concept was really an environmental One Health sort of concept where countries, particularly in Asia, controlling malaria. And then, of course, that all changed. It's sort of a concept of understanding your enemy and targeting different vulnerabilities of the vectors. That changed when DDT, the insecticidal properties of DDT, were discovered. And WHO jumped on the bandwagon of having a one size fits all and one sort of strategy everywhere. And let me just share my screen, and I will promise you I won't talk for very long. And what we are seeing now, this summarizes where we are with malaria, or where we've been recently in malaria vector control. Again, it's been a one size fits all, a heavy dependence on insecticide treated nets or indoor residual spraying, with some supplementary interventions that were recommended because they had a sufficient evidence base of effectiveness. But that's where we've been recently, but things I think are slowly starting to change. WHO obviously creates a lot of policies, a lot of guidance is put out there. This is just some of the recent publications by WHO providing advice to countries on how to go about malaria control, surveillance and control. And I just want to highlight a couple of key policies that have come out, a couple of key recommendations. And one of these is the high burden to high impact approach for malaria control. And I think it is a really a step in the right direction, because what it really is based on the principles of moving away from one size fits all, not treating malaria as a task to be performed, but a problem to be solved, and trying to optimize the way in which we deliver interventions. And that, of course, means that we've got to bring in other sectors and other players to help us do that. So I think that was, and it's also talked about using local data to stratify and to target different combinations interventions to different areas based on what we know about the ecology of the mosquitoes and the epidemiology of malaria. So I think that was an important thing, gain away from one size fits all, being more using a variety of different techniques concurrently and modifying that, tailoring that to the particular ecologies and epidemiologies. I think another document which came out very recently, which is, I think, a really important and interesting document, given that it came from WHO, is the global framework for the response to malaria in urban areas. And I think this was a fundamental shift in WHO's philosophy on, and I think it's moving us more back to the One Health sort of approach that used to be practiced successfully a decade or a century ago. Now, this document on urban malaria control I think it's notable for two major things. One was its emphasis on environmental management for malaria control. So going back to our original roots in many ways. I think it's also notable because it advocates for the pragmatic deployment of interventions in concert with recommended vector control, even if those interventions had a weak evidence base. So I think recognizing the lack of evidence does not necessarily mean ineffective interventions. It just means the sort of randomized controlled trials haven't been done to gather the evidence base of WHO, and many of us have relied on it for many years as being solid evidence for what we should do to control malaria. And then we can look at all the other documents, and all the WHO documents seem to have a Greek or a Roman temple. I'm not sure if these are Greek or Roman, but they all have similar sort of aspects that align much better with the One Health concepts. They talk about mobilizing resources across multiple sectors. They talk about intersectoral collaboration with many departments. They talk about engaging with the local community. They talk about health education and communication to change behaviors. And it talks about generating innovative solutions to malaria, which again means we have to engage with the communities in order to get buy-in, and we have to have more of a partnership with the malaria-infected communities to go forward. And I'll leave it at that and try to get us back on track a little bit. Thank you very much.
Thank you, Professor Burkott, on elucidating the how it has been aligned, how the WHO policy also, and also regarding the coordinated malaria response and the global framework to response, especially in the urban malaria. So now we move on to the next topic, next question to Dr. Owen. So traditionally, malaria is a major public health problem in Vietnam and Greater Mekong sub-region, which includes Cambodia, Laos, Myanmar, Thailand, and Vietnam. So according to the WHO, the Greater Mekong sub-region accounted for 99% of reported malaria cases in Western Pacific region in 2019. And also in the Mekong sub-region, it's a major public health problem with emergence of multi-drug strains of malarial parasite and other concerns. Now, can you share some examples from Vietnam and Greater Mekong region with respect to adoption of One Health approaches at community level in response to infectious diseases like malaria?
Yeah. Thank you very much. I am sorry that I had to disappoint you that I don't have an example of One Health approach. Why in India this discussion have probably been for quite some time and have already been put in practice, although at pilot level. I think we are still in a quite early day to practically realize One Health approach in our daily life, and not so in malaria. So for malaria response in this region, in this part of the world, I think many of you know already that we have the biggest problem of drug-resistant malaria but the number of malaria cases in the region have significantly reduced. When I finished my medical school 30 years ago, malaria was the #1 major public health problem. We had like millions cases of malaria a year. Now, like last year, we had more than 400 cases of malaria, 400. So it's but now the malaria concentrated along the border with Laos, with Cambodia, with the ethnic minority people and migrant population, with people going to the forest and who sleep in the forest farm. So this very concentrated. We haven't been able to apply the One Health approach in malaria control. Unfortunately, there have never been such a discussion. So that's why I said I'm so glad that we bring this up, the conversation here. The One Health conversation can happen in other forums, but at the community level, at our implementation level, it has not been brought up. It has got no investment so far, I have to say. All the investment for malaria so far is about the mosquito and about the fever and about the medication. So but nevertheless, there's an opportunity there. The investment that has been made for malaria is, in particularly from the Global Fund, have had to create a community system. So we was able to work with the local community to engage with a local leader or identify the potential leader and build their capacity and empower them and having them being connected into a network that learn from each other, inspire each other, and work beyond malaria. So in my slide, you will see the photo of a community leader. I would say he was recruited to work in our community malaria action team. But then since his capacity is strengthened, he's become more competent in many other aspects, in leadership and understanding and knowledge, he became a community leader. And so now his goal is not just about malaria. His goal now is to have many people in the community. So giving food for people who need food, distribute masks for people who need masks during the pandemic, helping people who don't have access to universal health coverage to have access to universal health coverage, working on TB and other issues. So that is the most important resources and most important investment that I have seen. It is investing in local capacity and to local community system. And I think that is a major impactful, sustainable result from the Global Fund investment in malaria in this part of the world. For this most, the poorest, the most deprived community. So I think that's what I can share. Yeah, we haven't been there in the One Health yet, but we have the very good foundation to start to build upon. Just like Rob Burkos mentioned, we need to engage with the local community, and this is probably the most efficient way and most sustainable way to do so. Thank you.
Thank you, Dr. Oan, for elucidating how community engagement and leadership training can make a difference. And maybe these are your first steps towards moving towards One Health in a better way. So thank you for sharing that and letting us know the work of different health groups and leaders like this. And it is truly very happy to see such leadership roles arising and such capacity building happening, especially in endemic settings. So shall we move on to the next question to Shri Swain. So, sir, what are some of the key sectors that need to be considered to implement this One Health approach in India. If you could elaborate with an example, it would be great.
Thank you, Dr. Marlene. Of course, if in the context of malaria, since it's been spoken about, I'll come back to the general talking about malaria in India. That if you have to look at the report of India's malaria kind of death, so after 2010, it has come down below 1,000 for the entire country, a country of size of India. And after 2016, it has come down below 100. So that signifies, one, that how India has moved in terms of malaria. Of course, it had a checkered history. If you go back to 1955, when the malaria control programs were actually initiated, but by that in 1958, elimination program was National Malaria Elimination Program was then. But in 1976-77, when actually there was an outbreak, so elimination again gave rise to the control. So that has been a checkered history. But of late, because of this sustained effort by the state government, because health is a state subject where central government of India provides the support to the states, both in terms of policy support as well as in terms of financing supports and other infrastructure supports, etc. So having said this, India has now sustained annual parasitic incidence API of less than 1 since 2012. And India is the only endemic country which has reported a decline of 17.6% in 2019 over 2018. This I'm quoting WHO World Malaria Report 2020. So given this, obviously, India has been in the forefront of tackling this disease. Let me come back to, since I said it's a state effort. In the state, let me talk about the state, a state called Odisha, from which I belong, from the eastern part of India. It was one of the topmost, it was the topmost state in terms of the percentage of the total malaria prevalence in the country. So way back in 2015-16, it was more than 1/3. So it was actually more than 1/3 in the entire country. But then today, about 2 to 3 years back, it has come down to even less than 1/6 of the entire country. They had undertaken a very specific project called Daman, which was in Odia language, but translated to English, it is elimination of malaria in inaccessible areas, because Odisha's southern part, 8 districts where this project was there, are basically are tribal, mostly focused tribal, with inaccessible road structure and having more endemic with malaria. So there are very concerted effort by various departments for both in terms of vector control, treatment, education, and also environmental control. So that way, they brought down this in a couple of years, this malaria very clearly. That is one of the very bright example in India, which actually led the entire part. Having said this, the sectors that you are asking, what are the key sectors that need to be considered to implement One Health? So obviously, One Health involves public health, veterinary, public health, and the environment. One Health is relevant for food and water safety, nutrition, control of zoonosis, pollution management, combating antimicrobial resistance, etc. Let me just confine to the agriculture sector from which I actually come. I mean, I'm working on this. If you have to look at agriculture sector, it has actually agriculture in India, of course, almost 60% population depend on this, are in rural areas and depend on agriculture sector, which contributes to 18% of the GDP, with contributing to about 40% of the total workforce. So that's the kind of importance of agriculture. That is why I'm bringing this sector. It depends on weather. It depends on, it has an exposure to weather, close contact with animals and plants, extensive use of chemicals and biological products, difficult working, etc. So let me give an example of paddy. Paddy, the world over, there is in India also, there's a flooding methodology that is followed. That is flooding of the paddy field, because paddy is also the water footprint of paddy is very high, and it is flooded method which is used. In this, it is a kind of breeding ground for malaria. That's very clearly not just in India, but even in African countries, you have been seeing them. So if you have to see that, so obviously agriculture is contributing to malaria vector very clearly. Of course, it may not, but it may not result into the malaria disease with the, I mean, with the farmers, because if they are able to have a kind of good health coverage, they can do that. But then there are various alternative methods of farming to this flooding method, which probably the farmers can, India is experimenting, such as direct seeded rice. Even we are trying to put actually things like larvicides applications to paddy field. Even paddy and fish combinations you have been doing in Odisha, also in a district of Baleswar, which is affected by malaria. We are trying to experiment paddy fish combination farming. The fish is a very good kind of one which eats out the larva of the malaria, and it is found to be almost 80% very effective in that, controlling the larva of that. And then there are SRI, system of rice intensification, so which was originated in Madagascar. So obviously, and then there is a kind of issue of alternative drying and wetting of the paddy field. Wet, it has to be wet, but there is a method of drying, I mean, wetting and drying, by which without sacrificing the productivity, which are also followed. So obviously, there are various examples which are actually can be taken to handle this One Health issue very clearly, along with the public health and others. So obviously, specifics to the context of malaria and vector-borne disease, agriculture practices may contribute to, though it may contribute to increasing breeding sites, but there are methods to also handle this. So in terms of key sectors, of course, in future, Ministry of Health will definitely, we are expecting Ministry of Health to play a very, very important role, apart from Department of Biotechnology, which is under the Ministry of Science and Technology, which is already coming with consortium and committees, multi-sectoral committees and multi-sectoral consortium. So we are expecting Ministry of Health to play important role in, already we are working definitely in that same directions. So we are expecting that more to evolve in future. Thank you very much.
Thank you. Thank you. Thank you, Dr. Sains, for elaborating how malaria control program paved the way for elimination program, and also elucidating how the newer methods of paddy cultivation and so as to improve the vector control, and alternate methods, paddy fish combination cultivation and rice intensification. These, I think, would mark the future of this One Health, would incorporate much of the future of One Health, and can significantly bring down the vector habitats also. So I think that marks the end of this session, and we are going to the proceeding towards the last session. And again, we have 3 key questions to discuss, one each to each panel members, and the response timings are 5 minutes each. So off to Prof. Burkott. So Professor Burkott, you are currently leading a research on evaluating zoonotic malaria transmission and agricultural and forestry land use in Indonesia. Can you elaborate on the objective and expected research from this research, and how it can help from evidence-based policy reforms to support holistic response towards disease prevention and elimination?
Yes, thank you very much. I just have a couple of slides. Yes, the Zoom Out project is funded by the Australian government through the Australian Centre for International Agricultural Research and the Centre for Health Security, and is a consortium of 12 institutions, 6 of which are Indonesian institutions. It has as its major aim to strengthen zoonotic malaria surveillance in Indonesia to inform public health efforts. And so we're basically, the objectives are to improve detection methods for simian malarias in Indonesia, and to evaluate agricultural land use factors associated with simian malaria parasites, and to evaluate the mosquito vectors by agricultural land type. So this really fits in with a couple of major themes that I was discussing earlier, one of which is land use change. The other is really outdoor mosquitoes that aren't really easily amenable to the recommended interventions that we presently use. And so what we're trying to do is lay the foundation, gather the information that allow for development of interventions that might interrupt or be used to interrupt simian malaria transmission. And just give you a little example of what we know about the vectors of Plasmodium knowlesi, which is the most well-known of the simian malaria parasites. And so there's 9 different vector species shown on the left of this table. And the darker the box, the better the evidence base for that we know something about their behaviors. And you can see there's a lot of boxes which are blank, where there's not a single published paper on the behaviors. And a lot of the evidence, when it does exist, it comes from 1 or 2 publications. And so really what we're trying to do is really understand some really fundamental questions of Plasmodium simian malaria parasite transmission in Indonesia, starting with what are the species that are responsible for transmission and what are their basic behaviors. And once we know this, then we'll be in a position to do more to try to target vulnerabilities in their behaviors that we might be able to control. And chances are it's going to require us to look at novel different intervention strategies. So again, these we believe are mosquitoes that don't like to enter houses that are outdoors. And so we have quite a challenge ahead of us. And I just want to show one last slide, which is, this is where we actually have some data about the locations where these vector species have been found. And that's been related to transmission of simian malaria parasites. So we have quite a challenge ahead of us, I think, in understanding simian malaria parasites. I think it's one of the biggest threats to malaria elimination in the Asian region, and it's going to be a real challenge. It's going to require integrated approaches. It's require educating communities, having good communication, and working with different sectors, particularly agricultural, forestry sections, along with the health sectors. And I'll just close at that.
So thank you, Professor Burkott, for sharing important info about the knowlesi vectors and other aspects which you have discussed. Now, moving on to the next question, to Dr. Owen. Dr. Owen, what do you think is needed from a community point of view to ensure holistic health, and how can we strengthen communities' involvement and ownership towards disease control and elimination efforts?
Yeah, thank you for interesting question. And I could see in the chat, I think doctor from Cambodia is asking like how can we make the animal health and the human health sector working together. I think it's really important, and now we are discussing in the framework of G20 and C20. It is very important to have One Health investment. I know that there's been some discussion, there's some One Health investment, some project, One Health project, one here to there. But I think if there's we need to have a kind of significant, serious stream of investment, funding investment, research investment in One Health. But for the One Health investment need to invest in community system, because to the end of the day, it's the people who live, people who breathe the air, people who drink the water, people who live in the environment with the animal, with the plant, with other fellow human being. So it's really important that we focus on people. Very often we talk people center, but we don't really mean it. And when we don't really we have a like agriculture sector, we have an agriculture sector, we have forestry sector, we have a health sector. Everybody doing their own piece, but not really focus on the people. So if we are truly people-centered, we should not only focus on the benefit of people, but people-centered in have another meaning of people taking the leadership for One Health. People is responsible for the planet health, for the animal health. And when you talk people center here, is the community at the center. So the community should be invested in, should be empowered to be able to make the decision for themselves and for the animal and for the planet on those behalf. Because to the end of the day, we breathe the air, we drink the water. So we have, so far there have been some investment, like I mentioned, the Global Fund in this Greater Mekong sub-region and other region have invested in community system, invested in the people, the very local community people, build their leadership. So we should capitalize on this. We don't have to start from scratch. Build on what the Global Fund have invested in. Those people, the men in front of you from the local community or we work with, they are capable of doing a lot of things. If you give them, if you work with them on the environmental health, they would understand about it. About animal health, they would understand about it. One Health, they would understand about it, and they will be able to make decisions for their community and contribute to research and policy and program. So again, investing in community system, community leadership, and invest in One Health, truly One Health. I stop here. Thank you.
Thank you, Dr. Owen, for showing us that people-centered approach, and that is truly relevant in this situation. So moving on to the final question of the panel discussion, Sri Prashanta Kumar Swain, from your experience, what are the first key steps that a government needs to take into account before embarking on this journey of incorporating One Health approach to inform its holistic disease response, particularly in a vertical health system? And can you also highlight some of the anticipated challenges in the situation?
Thank you, Dr. Marlin. You are asking me the challenges and all the steps. So let me start from the backward, that is from the challenge. Then we can talk about the kind of steps that we are taking forward. So before that, let me just make a quote a statement. There is no difference of paradigm between human and veterinary medicine. Both sciences share a common body of knowledge in anatomy, physiology, pathology, on origins of diseases in all species. If you have to accept this, well accepted the statement of paradigm, then obviously there are challenges that we'll be facing in terms of approach or the steps that you have to take it. What are the key challenges that we face in those? If you have to look at it in a developing country like India, where, of course, I gave an example of paddy because paddy is a kind of major crop, food crop for food security reason. We are producing almost 200 million tons of it, not only feeding ourselves to our country, but feeding outside India by exporting it also. But then we have to understand, when we are so immersed in our own vertical, what are the challenges facing this? So that is barriers which are there as under recognition to economic and health benefits. That's one of the most important challenges that we need to understand. Then, of course, fragmented and disconnected governance of human health, animal health, and environmental health. Third is the absence of agreement between policymakers and professionals on way forward. Fourth, of course, inadequate joint training and capacity building. That is lack of clarity about the concept and scope of One Health approach. It is not just for India, but for all over. Then understanding of the definitions. Then fifth, of course, is the paucity of data on interactions between human and animal health and its implications. These are the 5 major categories of challenge, which is for any country. These are the major challenge, which has globally also been talked about. Of course, for malaria, there are specific challenge, which Professor Burkert has already brought out, even Dr. Vahan has already brought out. I will not focus on that. So having said this, we need to understand as to what are the kind of major elements in the entire policy making, which are important for a governance system before taking the steps. So, first of all is the political commitment to One Health. That is very, very important. Luckily for us, Honorable Prime Minister has been driving it from the top. Is a visionary, setting the kind of mission and vision for the entire country, taking care of the global directions, global and emerging, and even the emerging science and technology. The other is the policy formulations. Third, of course, is the sustainable financing, which is very, very important, whether it is investment of the community that Dr. Kwan had said, but otherwise financing research or financing surveillance. This is very important, sustainable financing. Then program development and implementation, because various schemes have to be brought out, like a developing country like us. Capacity enhancement, engagement of civil society, active participation of communities, and awareness raising. Having said this, let me talk about 10 steps that I have brought it. I mean, I want to bring out here, which are very crucial for India, and probably I can give a lead to others. That is, we need to first identify in-country champions who can interact with leadership, governance, institution, and communities at all levels. Institutions means research and other institutions and communities. The second, of course, is develop present evidence-based burden of zoonosis on health and food security from situation analysis. Third, of course, is analyze economic burden of disease on human health, impact on trade, GDP, poverty reduction, effort, gender inequality using One Health framework. Then systematically assess existing strength and major gaps within public health, veterinary, and environmental sector. The gap analysis is very, very important with respect to the One Health aspect. Support establishment of multi-sectoral and joint mechanism of activities planning and implementation. Of course, we have already the committees, etc., which has been set up in this direction. So we hope that a lot of activities now will be happening in a way that it is being talked about in the developed world, which already we have been doing. Then, of course, then develop multi-sectoral training plan comprising need assessment, development of curriculum, identify trainers across sectors, and identify groups to be trained, target groups to be trained, and the training schedules. So that's very, very important, and with a commitment, it can be done. Identify and designate institutions of excellence in all sectors and expand their mandate for collaborative activities and research priorities on One Health, cutting across their own activities. Then develop joint monitoring and evaluation plan and use it to monitor progress through indicators, well-developed indicators. The indicators have to be developed based on the local, regional, and national conditions, multi-sectoral conditions, and then monitor them and evaluate them. That's very, very important from time to time, because there has to be a very quick response in case of this zoonotic diseases. So we need to have that very sector clearly. Develop and implement comprehensive risk communication strategy, taking into account societal factors, non-pharmaceutical actions, utilize trained grassroots workers. That's very important, because community involvement is very, very important. They have to be, the communication patterns have to be really brought out and very clearly mandated and then brought out. So these are the steps which are to be generally taken for the government, for the future action plans, which can be there very clearly for us, ahead of us. And it can also, we can definitely, it is, though it is India, I'm talking in the Indian context, we can certainly look forward to a kind of collaborations in the ASEAN region, where, of course, Dr. Burkert spoke about the P analysis, which is, of course, in our Andaman Nicobar part, which is a group of islands. 572 islands are there on the Bay of Bengal. So we have this detection of the P analysis. I mean, from there to the East Asian region. Southeast Asian region. So obviously we have a commonality of this vectors, and so we can have a kind of research grid cutting across the research. And in terms of the training, that some development has taken place, definitely, which is very, very important in the global forum, and we need to really look into that very clearly. If you have to look at those training programs, there is a regional network for Southeast Asia, that is Massey University of New Zealand has been coordinating network of One Health hubs in 8 Asian countries, including India. So that is going to be a kind of, that is India, Nepal, Afghanistan, Bangladesh, Bhutan, etc. They are there. So they can be the kind of important hub and resource for capacity building and technical input. Then, of course, Southeast Asia One Health University Network is now there. That is, of course, India is not a part of it, established in 2011 and comprising of 87 universities from different countries in the Asian Pacific region. Of course, India needs to also have that, so that collaborative efforts can be there in this in terms of malaria. One Health, it is one health, one nation, one health, one world, one health. So approach can be there in this entirely. So thank you very much for some of these suggestions, which is probably from my side. Thank you.
Thank you, Sri Sen. Sir, actually, the way in which you elucidated on the challenges and also the way forward in terms of the way forward for the country in terms of capacity building, in terms of taking community champions and country champions. They all, I recognize that this would be the, even though we don't have a defined one health approach, this all will be the first steps and the way forward. So this marks the end of this session, and we have a few questions to the panelists. And one question to, I think, Sri Swain was about how he actually tried to convince between human health and animal health to work together. I think he has already acknowledged the question in his current discussion. He has mentioned about the paradigm between the human and the veterinary health, and I think that was already acknowledged in the current discussion. And there was a couple of other questions. One is to Dr. O.N. So, Dr. O.N., do you think that the advocacy for One Health in malaria can be translated from bench to bedside with newer technology?
Dr. Merlin, we're just going to do Dr. Sadek's comments as he has another engagement, and then we'll do the discussion. I apologize for the change in schedule.
Oh, sure. So I invite Dr. Satek to have his closing comments.
Thank you. Thank you so much to you, Dr. Merlin, for accommodating that. And my sincere gratitude to the esteemed panelists, Sri Swai, Dr. Owen, and Professor Burkott. This has been just a remarkable conversation, and I sincerely appreciate you accommodating the request to end, for at least from my side. I just took a few quick notes along the way, and I am going to take the liberty to just share a few quick slides in summary that I hope will echo what has been shared. And so I'll try to keep it as brief as possible. The first thing, just to return to the subject of malaria elimination as a closing part. And for those who are joining and who aren't aware, the Asia-Pacific Leaders Malaria Alliance supports the commitment of 18 heads of state across Asia-Pacific to eliminate malaria by 2030. And the first slide I wanted to say is that this particular session is so important because for us to remember, I think that this is something that can be done in terms of elimination. Yes, we acknowledge the tremendous complexities, but perhaps One Health offers an important vehicle. But I think it's also important to remember, as a group of civil society coming together to think about this, we are making choices in global health. And if we can do complex things like build systems for HIV or dramatically reduce burdens of TB, we can certainly finish the job on eliminating malaria, as has been done in many countries in the world, as was done by China this past year, and there's an economic case for it. To summarize the speakers, I just wanted to share this quick stool that I put together, which I think that captures a lot of what we heard from Shri Swai's perspective, and this does not do it justice in any way, but your last response in how we practically work to enable a policy process. I think the first tool of political will, the elimination goal for that matter, or One Health as an approach, won't happen without sufficient political will. And as you rightly pointed out, the G20 presidency this year is an excellent example of that in terms of being the part of the commitment to eliminate malaria. And at the same time, that needs to carry with it true cross-sectoral collaboration, as we're seeing based on this discussion. This is not a Ministry of Health alone endeavor, and it really has to be whole of government. And the second thing is really it's about being evidence-based and transdisciplinary, and how do we push, as Professor Burkhardt showed, as you know, whether there's the complexity of issues related to primates and humans, animals and humans, and then the broader climate. There isn't a way around this problem in the old way, or ways of doing things that are siloed. And then lastly is thank you to Dr. Owen for so eloquently describing the importance of vulnerable communities and the important need, which I think was also cited by Shri Swine and was also cited by Professor Burkhardt, the need that whatever solutions we are coming up with, and I'll go to this last picture because I think it captures better than any three-legged stool can. Ultimately, the only way that we are going to be able to make headway is if we can build bridges, and I use the analogy of root bridges, because root bridges are stronger often than cement and steel. They take trees that are nurtured over decades, but they are from the place, and they can provide an important way to cross very difficult rivers, and they're born out of the place themselves. And so from whatever solutions that we're going to come up with, as all the speakers shared, they have to come from the place. And so with that, I will stop. And I am so grateful also to the Dr. Priya Nair, Dr. Jaideep Menon, the Health Working Group, and to our moderator. And we are so grateful for your thoughtful engagement in this webinar on a Wednesday in the middle of the day or night or the morning. Thank you so much.
Thank you. Thank you. Thank you, Dr. Marlin. Thank you, Dr. Sarthak. Thank you, Dr. Jaideep. Thank you, Dr. Priya, and my co-panelists, both co-panelists, Dr. Burkhardt and Dr. Kahan. So it's been a fantastic engagement. And let me also thank the way you have conducted it. It's very, very internationally, anywhere it will be recognized as one of the best seminar that you have hosted very clearly. So thank you once again. So let us be in touch to take the cause of malaria in a kind of intersectional, cross-sectional and transectional way. I being from the agricultural sector. Thank you, my both co-panelists once again. And I am very fortunate to have you as my co-panelists. Both of you are so renowned. And in fact, just 2 days back, I went through the Google to find out about the background, and I was very amazed to see the kind of reputations you have. So this panel has been blessed with your presence and your deliberations. Thank you. And once again, the best wishes on behalf of 140 billion people of India to the entire world when we are leading this G20 this year. So from India and Indian people, Indian doctors, Indian diaspora, from all of us to the entire world and to all of you. Thank you. Thank you very much.
Thank you so much. But we have a couple of questions. So it will take less than a minute. So to Dr. Owen, these are questions from the audience. So social situations like poverty usually add on to the morbidity and persistence of disease like malaria. In this context, how should we approach the disease per se and the social situation leading to the disease? So the audience have requested your insights on this. Should I repeat the question? You are not audible, Dr. Oam.
Yeah, sorry, I was just accidentally disconnected. But
Okay.
yeah.
I'll repeat the question. You
Yes,
want?
please.
Yeah.
Yeah.
So, social situations like poverty usually add on to the morbidity and persistence of diseases like malaria. In this context, how do we approach the disease per se and the social situation leading to the disease?
Wow, that's the big question. That's very big questions. But I'm glad that you asked that question because that is so fundamental. I think we cannot do the patchwork. So I think that is the whole idea behind the Sustainable Development Goal. That's why we have 17 goals and not just one goal, and not 1/3 of the goal, right? Ending HIV, malaria on itself is one goal, and together is with 16 other goals. So I think we need to really work on the whole agenda of Sustainable Development Goal. But again, I would like to repeat that it needs to be rooted in the community. It has to start with the community and end with community. So any plan to work policy need to be discussed with the community. Plan needs to be developed together with the community. However, for community to be able to meaningfully discuss participate in the conversation, investment need to be made to the community system to empower the community so that they can be meaningfully being a part of the process and make the decision for themselves. I saw also the other question about the role of innovation. I think it can certainly play a huge role in the community system and community leadership. I can give you a very simple, small example of our malaria program. We provide mobile phone, smartphone to our malaria community worker, and train them how to use the smartphone, and also different application and software. And with that, they when the COVID struck, they was the ear and the eyes of the community. They can help the community to communicate with the outside world. We learn together, we share information, we do training on their smartphone. They share information, picture, plan. So yeah, I mean, sorry that we don't have a simple answer, but the simplest way is to start with the community, introduce the concept of sustainable development and One Health to them, and then take their guidance into the process of developing the program and also in the process of the investment. I can spend a day discussing this with you, right? If you are interested in, that's yeah.
Thank you, Dr. Owen. So, last question from the audience to Professor Burkott. What can be done to assess the community readiness for malaria prevention and treatment? Any role of participatory learning approach to deal or eliminate the same for Indian setting? So even it is not for Indian setting, in a general setting also, is there any role to have this participatory learning approach?
Well, I certainly think that, engaging the community is critical, and education, the basics on understanding the mosquitoes and transmission and the malaria cycle are going to be important. I mean, we're looking at a new golden age of mosquito control, I think, but there's a lot of investments in novel ways. When I showed them the outline of the mosquito life cycle, there was only a couple of activities on that cycle that were being attacked right now. And there's a lot of work going on now on things like spatial repellents, topical repellents, attractive targeted sugar baits. There's many things that will require, that are not necessarily high-tech solutions, but will require buy-in from the communities, engagement from the communities, and I think their participation to make it to make them effective. So I think the need for community engagement is just going to grow ever stronger. The days of the vertical program and the one size fits all, of having a intervention that'll work everywhere. I think we're looking more at, if you want to call them boutique, or things that are really targeted to the specific ecological and epidemiological situations. And I think that's the future of malaria control if we're to achieve elimination.
Thank you, Prof. Brakhor. So that marks the end of the Q&A session. So to summarize, Professor Tom Burkott had elucidated on the cross-cutting issues related to the transmission of malaria in the Asia-Pacific region and how they affect the goal of malaria elimination. He also had his important insights on trends in the regional vector management, about the trends in the Anopheles stephensi and the aegypti in the urban regions, the insecticide resistance, the urbanization, and the integrated vector management in the vector control, changing land use, tree cover loss, climate change, and the monkey malaria and the like. And finally, I thank you, sir, for your valuable inputs to the panel discussion. And Dr. Owen gave us real-time glimpses of poverty, the deforestation, the malnutrition, how it actually contributes to the rising incidence and the persistence of the vectors, and the importance of working with local community and enabling capacity building and having a people-centered approach. And that could be the basic steps of One Health as we see it. Dr. Swain elucidated on One Health from a local, from a national, and from a global level. And he actually gave examples of several successful models, especially the Daman model from Orissa in India, several agricultural controls which can come up in the future and can be embedded into practice while encompassing the One Health approach, and also elucidated on the challenges and what the country needs to do to embrace this One Health in future. My big thanks to each and every one of you for your valuable insights, and Om Namah Shivaya. Thank you. Muted. Thank you, one and all. This marks the end of the webinar. So my hearty thanks to all participants and panelists. And I hope you join us for our upcoming public webinars and our awareness campaigns also. And also in our summit at Faridabad from April 7 to 9. Thank you.
Thank you, Dr. Marlin, for conducting so fabulously this seminar, so fantastically and so professionally. You deserve a big thanks and applause. Thank you from the farmers and agriculturists
Thank
from
you,
my
sir.
side. Thank you.
Thank you, sir. Thank you, sir.